We're starting to see lots of data in the market about Medicare Advantage changing its model, clamping down, MLRs are being challenged, supplemental benefits.
Yeah.
You've been in this space for quite a time from many different angles.
Yeah.
And of course, I think over the last 4 or 5 years, we didn't even have the language that we have now, which
Right.
sort of put this on the map. But what are you seeing in reality? How fast are we moving? How far are we headed? How much do plans understand this? How much do CBOs really believe they can be part of it? Like, what's the reality check outside of the white papers?
So I think that I think fundamentally, this is not a new problem, right? I mean, this has been a problem forever. I think everybody feels like they need to move really fast. There's so much, digital. We can solve it through technology. So there's a lot of really good efforts being made. We've talked to a couple of providers and a couple of health plans who are like, just package the solution for me because I can't deal with all these different pieces and parts anymore. So I guess my sense of it is, and based on what we've seen and talking to the customers we've talked with, there's been so much urgency to address it, not a lot of framework to address it. And so it's like, let's slow down a little bit so we can speed up a little bit. It's like I mentioned a second ago, these CBOs were like, give me a contract, that's all I need. It's like, no, you really don't. And I'm looking at Josh, we talk a lot about compliance. It's like there's a whole bunch of stuff in Medicaid, you have to have, there's lots of rules that have to be met. How do you do this the right way so it's sustainable? And so I think we're kind of slowing down a little bit. We're thinking more holistically. We want to leverage technology to its capabilities. And then we have to think about what really moves the needle. And of course, in our view, we think it's both a holistic solution delivered locally to an individual in a way that helps their well-being. And I think you have to slow down a little bit before you can take off. And so I think we're sort of in that space because there's a lot of energy around it right now.